Most people don't realize this. Some surgeries don't make you better. They change you forever. I'm a surgeon, and there are operations I would never recommend. For my own family, after 60, most people believe that if a surgeon recommends an operation, it must be the right choice. The doctor knows best. The hospital has the equipment. The paperwork is ready. Just sign here. I used to believe that too, until I started counting the patients who went in for routine procedures and came out permanently changed. Not better. Changed. A man who walked in with back pain and left unable to walk at all. A woman who survived open heart surgery, but lost 6 months of her life to complications nobody warned her about. Here's what nobody tells you. The older your body is, the harder it fights just to survive an operation. Not the disease, the operation itself. My name is Dr. Kevin Adewale. I'm a cardiothoracic surgeon with over 2 decades in the operating room. And today, I'm going to tell you the truth about 5 surgeries that carry serious hidden risks for people over 60. Let me ask you something. If you take a brand new car and a car with 200,000 miles on it, and you put them through the same stress test, do you expect the same result? Of course not. And yet, for decades, medicine treated a 70-year-old body the same way it treated a 40-year-old one. Same protocols, same recovery expectations, same timelines. That's starting to change, but not fast enough. Here's what happens inside an older body under general anesthesia. The heart works harder. The lungs take longer to clear the anesthetic. The kidneys slow down processing medications. And the brain, this is what surprises people most. It can become disoriented for weeks, even months. Doctors call this postoperative cognitive dysfunction. And in patients over 70, it happens far more often than anyone admits. Let me be very clear. Age alone is not a reason to avoid surgery. I've operated on 80-year-olds who recovered faster than some 50-year-olds. Age is just a number, but frailty is not. Frailty means the body's reserve has dropped below a critical threshold. About 40% of people over 75 show signs of frailty. Nearly 60% over 85. So here's the real question. It's not whether someone can survive the operation. It's whether they can survive the recovery. And those are 2 very different things. Surgery number 1. Open heart surgery in frail patients. Coronary artery bypass grafting, CABG, is one of the most common major surgeries in older adults. Blocked arteries reroute the blood flow. Simple in theory. But here's what the brochure doesn't show you. Your heart is stopped completely. You're placed on a bypass machine that takes over the work of your heart and lungs. For a healthy 60-year-old, manageable. For a frail 78-year-old, it can stress every organ at once. Studies show a 30 to 40% risk of major complications: stroke, kidney failure, confusion, ventilator dependence, and up to 15% of high-risk elderly patients do not survive the first 30 days. So what's the alternative? In many cases, a catheter-based procedure. No open chest. No stopping the heart. Less dramatic, but much kinder to the body. Ask your surgeon one question. Am I a candidate for a less invasive option? That question alone can change everything. Surgery number 2. Aggressive spinal surgery. Back pain in your 60s and 70s is almost universal, and more patients are offered. Spinal fusion surgery. Multiple levels. Metal hardware. Permanent changes. Now, listen carefully. Some spinal surgeries are absolutely necessary, but elective fusion for chronic pain. In elderly patients, the evidence is troubling. A major study in the journal Spine found complication rates over 40%, blood clots, infections, hardware failure, and something called adjacent segment disease. The fused area becomes rigid, and the rest of the spine pays the price. And here's the hard truth. Many studies show no better long-term pain relief than physical therapy and injections. No better results, but far greater risk. Sometimes the best surgery is the one you don't do. Surgery number 3, major cancer surgery. When people hear cancer, the instinct is immediate. Cut out, remove it. But the real goal is not just removing the tumor. The goal is giving the patient more good years of life. And sometimes major surgery does the opposite. Take the Whipple procedure for pancreatic cancer, one of the most complex surgeries in medicine. 6 to 10 hours. Multiple organs involved. In young patients, it can save lives. In frail, elderly patients, the surgery may succeed, but the patient may not survive the complications. This is called futile surgery, and it happens more often than people realize. Nearly 1 in 5 elderly patients experience what's called failure to rescue. A complication occurs, and the body cannot recover. Ask your doctor this. If we don't operate, what are the alternatives? Watchful waiting, radiation, targeted therapy. Sometimes those options are better. Surgery number 4, elective joint replacement. Hip and knee replacements can be life-changing. For the right patient, they are incredible. But timing matters. In patients over 75 with multiple health conditions, risk increases significantly. The biggest danger: blood clots, clots in the legs that travel to the lungs, pulmonary embolism, life-threatening, and pneumonia, infections, and the picture becomes complex. The question is not, should I have surgery? The question is my body ready for it? Optimizing health beforehand matters. Blood pressure, blood sugar, weight, heart health. Some hospitals now require rehabilitation programs, and that's a very good thing. Surgery number 5, emergency abdominal surgery. This one is different. You don't choose it. It chooses you. A ruptured appendix. These situations, internal bleeding. But here's the reality. Bowel. Mortality rates can reach 30 to 50% in elderly patients, not because surgeons fail, but because the body is overwhelmed. Multiple organs under stress at the same time, and the inflammatory response can spiral out of control. So what can you do? 2 things. First, don't ignore symptoms, pain, bloating, changes in bowel habits. Act early. Second, have the conversation now, not in an emergency. What are your wishes? What quality of life matters to you? These are not difficult conversations. They are necessary ones. What should you do before any surgery? Ask these 4 questions. What happens if I don't do this? Is there a less invasive option? What will recovery look like for me? And what is your complication rate? For patients like me, final message. Here's the most important thing. A surgical recommendation is not a verdict. It's the beginning of a conversation. You are not passive. You are part of the decision. The surgeon holds the scalpel, but you hold the choice. Be informed. Ask questions. Get a second opinion. Your age is not a weakness. What question would you ask your surgeon before a major operation? Write it in the comments. And if this video helped you, share it. It might matter more than you think. Take care of yourself. Stay curious. And always advocate for your own health. And one last thing. This is general medical information. Every case is unique. Always speak with your own doctor before making decisions, because that conversation is where good medicine truly begins.